Hello, it's Dr. Erica. Welcome back to my channel. Please like, share, and subscribe if you haven't already. My main channel, Erica OnagbolaPharmd. I am just going to talk about listening to your body, listening to um, the language of your body to let you know what your body is telling you, whether or not you understand, or you may be just listening to echoes of what your body is saying, or you want to follow along with what your body is trying to tell you. The body can give you a direction as to what is happening internally, as well as what could be underlining what could be happening on the outside, what you see on the physical with your eyes. So let's let's dive deep into this video about what your body may be talking to you about. Say, for example, your digestive system, when you eat something that's not compatible with your system, your body is going to begin to talk to you. It's going to begin to react, and you may hear sounds, you may sense internal activities that may seem something may be off, something may be wrong, or this particular food item may not be the best choice, or maybe not the quality of choice that's going to suit me long term. So when we eat and our digestive system begins to growl, or begins to churn, or we begin to feel stuffed or gaseous or gassy, or we feel lactose intolerant, or we might feel our rectum, issues in our intestines and our rectum, or we might feel issues in our esophagus or in our chest, right in the sternum, behind the sternum. That could be acid reflux, that could be heartburn, for example. And if a particular food item that notice is causing that particular event on every ingestion or consumption, then that tells you that you may need to change quality, change brand name, or do away with that particular consumption of food item altogether in order to have a better outcome. Another example could be your skincare products. It could be what you put on your skin, how often you apply products to your skin. Is that product relevant? Is it actually performing its duty? Or if it's just something that is cosmetic or aesthetics? So you just have to watch out for rash, watch out for sulfur reaction, watch out for hives, and watch out for allergic reaction on your skin. Monitor your skin. Apply only according to what the indication suggests, so that you can get the best therapeutic outcome of that particular item. Um, UV sunscreen, for example, is very popular, especially during the summertime, during the springtime, when the sun is highest in our solar system. We feel more UV rays coming in through the Earth's atmosphere. So we choose UV spectrums that are particularly going to help us. We may choose a zinc cream as well to help with UV protection when we're out on vacation, for example, or out on the beachfront, for example. We want to protect our skin, and our body will respond if we're not protected. And that could be a sun damage. It could be a cancer um, event as well. They may be underlying cancer skin cells. So our body will talk to us. We just have to be watchful, and we have to respond accordingly to find out if this is something that we need to look into further. So the skin is very sensitive. Our skin is our largest uh, body organ system that we have. Our skin is our first defense against antigens, against microbes and parasites. It is our first defense. And when it is compromised through a wound or a puncture or through cancerous cells or um, through allergic reaction, we or sulfur reaction even, we'll see the response appearing, and we can monitor that. Skin tags are another example. Mole formation is another example of our body speaking to us and talking to us. The fragility of our proteins, our hair follicles, the thinning of our hair follicles, the thinning of our nails, the thinning and change in our nail bed, which can change colors. It can change ridges. The ridges of our nails can change. That's all talking to us as individuals, letting us know that the body is changing. So the body talks to us. It talks to us to let us know that our health is changing, our age is increasing, and that we are entering a new phase of life. Even our bones change. We begin to have less dense bone marrow. When we have less than bone marrow, then that means that we are more prone to falls, risk of falls, and bone fracture. We are more prone to episodes of bone loss and less potential for us to produce red blood cells. So our bones even speak to us even as we age. Um, less we become more fragile in our bones, and our bones tell us that we need to incorporate supplementation medication to help strengthen our bones, our hip area, our vertebrae area, our our legs. All of those need to be strengthened through exercise, through diet, through weight bearing exercises. That means lifting weights if we can. Um, you working out with weights if we can, to help with strengthening our bones. Also, um, for females, our monthly cycle speaks to us as well. You can monitor your monthly cycle, the quantity of discharge, as well as the time frame of discharge each month, to learn about fibroids, to learn about endometriosis, to learn about cervical cancer potential as well. So, monitoring the female activity throughout the month can also help learn and what's going on in that area. If there are lumps in the abdomen area, there might be a large fibroid there. If there are excessive bleeding during the month, that could mean endometriosis. Um, and that can be checked on during your pap smear, your annual pap smear, cervical biopsies as well, to help uh, regulate any changes that you may notice. So, another thing that we can do is to monitor our tissue, our lymph node growth under our armpits, along the wall of our breast, under our breast, in our neck area. There might, if there's a change in our lymph nodes, you'll see a bulge under the skin, under the muscle where the lymph node has grown excessively, and you can monitor yourself. You can just feel around, um, and with your own self-examination, feel around if there's any lumps in certain areas, anything abnormal, to relate to your physician for further check for early detection of, it could be a lymphoma or uh, a breast enlargement or breast tissue or breast cancer, what have you, you want to do your self examination on those areas. If there's anything else I want to say, if you're diabetic, monitor your skin, monitor your feet. You want to monitor under your feet. You want to monitor your sensitivity of your toes. You also want to be careful um, with drying your feet and applying lotions to your skin as well. And you also want to, for those who may be dealing with hemorrhoids or a history of hemorrhoids or uh, colon cancer, you want to monitor your blood stool for blood, dark darkness in your stool, bleeding, any type of bleeding. You want to be cautious. It might not be hemorrhoids, it could be colon cancer cells. So monitor yourself when you're after using your restroom. Monitor, just look back into the commode, see if there's any blood that has been discharged. Also, you want to wipe softly with tissue or with wet wipes or what have you. Wipe softly and gentle so that you don't disrupt that area. Also, if you are someone who's prone to urinary tract infection, you want to monitor the color of your urine, monitor how frequently you're going to the restroom, monitor how often you are having to use the restroom if you are experiencing a burning sensation or you are feeling um, a, a sense of urgency when you before using the restroom. Just monitor for different signs and symptoms. You can't go wrong with getting early detection to help prevent the need for further medication or extensive medication. And women, monitor your you want to make sure that you're monitoring the amount of moisture in your feminine area, the amount of discharge, the color and odor of your female areas. You want to monitor those as well so that you would know your pH balance. You would know whether or not you um, are are experiencing a change in your microbiome, and that can change your pH, that can change your odor, that can change your discharge, that can change the color of discharge as well. If you are discharging, your body is telling you that there's an imbalance. If your body is telling you there's an imbalance, then you need to go further to help with moisture control, to help with a antibacterial or antifungal prescription. Usually you can get that from your gynecologist or your primary care physician. And you also want to just monitor as you get older, monitor your perspiration, whether or not you are needing further fragrances or antiperspirant, aluminum free deodorant. I suggest using underarm. Again, that's antiperspirant, aluminum free deodorant if you are able, and use bar soaps as well as antibacterial soaps. You can use or interchange those however you need to. Um, Another thing is that you can monitor for is your teeth and your gums. Your teeth and your gums are connected to your blood flow. Your blood flow um, can become contaminated if your teeth and your gums hygiene is compromised. So if bacteria and food particles are not cleansed or properly uh, taken care of in the gums, along the tongue, along the top or the palate of the mouth, along the between your teeth, flossing twice, 3 times a day, all of that can contribute to blood poisoning. So do be aware of personal hygiene as well, mouth odor, bleeding gums, bleeding between teeth. All of that signifies that your body is talking to you to tell you that there is an issue, an underlying issue that needs to be treated. And you can visit your dentist to learn more about what could be happening. Again, that's bleeding between your teeth. That is also darkened teeth or plaque formation of the teeth. All of that is a message to you that there is an underlying condition that could be detrimental and affect your bloodstream. So, if you are dealing with itchy eyes or red eyes or dry eye, that could be a sign that your body is telling you that you are growing older or you are allergic to something, or you might be going through a perimenopause if you're female, or you're maybe going through a hormonal change. Especially in women, your dry eye can tell you that your hormones are changing. Itchy eye can tell you that you are allergic to something that you might have been recently exposed to. Watery eye could also mean that you have a bacterial infection in your eye or a viral infection in your eye, and that you may need an antibiotic or a steroid. So watch out for your visual changes as well. That could be a sign of glaucoma if you are having visual changes, or that could be a sign of cataract development as you grow older. So different symptoms in your eyes can be telling you things as well. Also, for women, if your inner ear is itching a lot, if you're having to clean out your ear a whole lot, that could be a change in your hormonal level as well. So the ears speak to us as well. If you're hearing ringing in your ear, that could be a sign of hormonal changes. If you are feeling or sensing a slight change in the perception of hearing, that could be hearing loss. And you can talk with your doctor about hearing aids. You can talk to your doctor about the changes in the frequency at which you're hearing things, or any changes. And also, um, if you are someone who is having congestion, chest congestion can be a marker of a different things. It could mean that you are not getting enough exercise and you're collecting mucus in the back of the throat. Um, that also can mean that you are dealing with a sinus infection or a upper respiratory tract infection. So chest congestion could naturally just mean that you need to be more active. It could mean that you are dealing with allergy, or it may be that you are dealing with an infection, a respiratory infection that could be cleared out. But you have to, again, detect it and see to a physician or someone who could help you with symptoms until you can get the proper uh, medical attention. Okay, so that's what I want to mention, that you just should, in general, listen out to your body, listen to your body, um, understand what your body is saying. Changes in any aspect of your body deserves attention, especially if it wasn't there before and you're now noticing. A lot of things can't be prevented. And some people, feel like they have to gather their own information first before they can ask the doctor to look into it further. So that's what I want to talk about on this particular video. And if you have likes, comments, and shares, please let me know. I hope this has been helpful to you, and I hope to see you on my next video. Signing off, Dr. Erica. Take care. Bye bye.